So your name is Anju Das?
Yes, right.
Okay. Anju, so how was your commute today?
I came by bus from Nagambaram to here. And
Did you get stuck in the rain or?
No, sir. It was pleasant atmosphere and pleasant weather, so I didn't get any interactions in between.
Okay.
So it was a nice journey for me.
So Anju, tell me a little bit about yourself.
I'm Anju Daske. I'm a nurse by profession. I belongs to Rani. It is a small village in southern part of the Pathanamthitta district, and I studied in Bangalore my BSc nursing course, and it was a 4 years course. It was a nice experience for me because I had so many friends and I got exposure to so many patients, and it was moreover it was a multi-specialty hospital. So I have successfully completed my course, and now I have 3 years of experience in my profession from a pediatric department. So I'm a well-experienced nurse.
Great. So what are you taking the OET for, Anju?
I prefer OET because I want to work as a registered nurse and I want to upgrade my profession as an English proficiency test. So I required this for work as a registered nurse in United Kingdom. So I selected this OET.
Okay. All right. So today what we're going to do is we're going to do some role plays. So 2 role plays.
Good afternoon.
Good afternoon.
I'm Anju Daske. I'm one of the registered nurse working in this hospital ward. May I know, you seem so anxious and worried. May I know what is bothering you?
Nurse, I am really pissed off. I'm really angry. Yes, you're right on track. I am not happy. My father was scheduled for surgery at 10 a.m. this morning, and it's about 11 going into 12 now, and he has not been taken to the surgery theater. What's going on?
I can able to understand your concerns and feelings. Actually, please try to understand our situation. Actually, we had a surgery previously. That patient was not well now. He had never undergone a surgery before, and moreover, he had not gotten exposed to anesthesia before. So he is suffering with post-operative vomiting now. That's why this surgery for your father has delayed. So please try to apologize for me for this delay.
We are all patients, so some form of the communication should have been done as an ongoing basis, and that's not happened. This is a total lack of professionalism on behalf of the nursing staff, on behalf of the management team, on behalf of the doctors. At least let your patients who are waiting. My father has not had anything to eat since last night, so he went to bed. Whatever snack that he had is there. Now he's not had any water, he's not had any fluids, he's not taken his medicines, and he's feeling very sick and tired. He does not know if we don't even know if he's supposed to go to the restroom or not. There's been no communication. This is high level of unprofessionalism that's been displayed.
So sorry to hear it from you. Please try to apologize me from my bottom of heart. I am apologizing. I am extremely so sorry for hearing this from you.
I'm sure that I'm not the only patient who feels this way, right? I'm sure that you have scheduled many other OTs today. Operation Theater has been scheduled. I asked the other nurses, the OT is running full today, and you have not communicated. There's been no communication throughout this whole time period. What's going on? Do you not think that this is highly unprofessional, lack of professionalism that's been demonstrated here? Okay. I am really irate. I want to take my dad out of the hospital and take him home.
You are right. Today is a very busy day. Plus, please try to understand your situation. Your father is on IV fluids. He'll get the necessary energy from that. He need to be empty stomach for the operation. And just wait for 10 minutes. I'll make arrangements within that time. And
see, my father's rights as a patient has been disregarded here, right? So no food, no water, nothing's been going on. There's been no care that's been administered. No one's even come in to check with us. That's happened, right? So about an hour and a half, he was supposed to be in surgery at 10 o'clock. Everything was supposed to be prepped and done. And now, what are we looking at? What timeline are we looking at?
I can able to understand your concerns and feelings, but please try to apologize me and please try to understand the situation. Actually, what has happened, I already informed you. Within 10 minutes, I'll make arrangements for your father. Your father's vital signs are perfectly all right now, and he's stable now. He can be taken for the operation right now.
So you want to wait until he goes into a coma, or he falls down, or goes?
No.
Is that what we're waiting for?
please try to understand my situation. Just wait for 10 minutes. I'll make arrangements within that time and I'll shift your father directly to the operation theater. And he's...
So you told me previously that the previous patient is still there. So you're still, has he completed the surgery or is it still ongoing? What's the status on that?
Within this 10 minutes, we'll shift the patient to the recovery room and we'll arrange for your father's surgery. And meanwhile, you can talk with your father and you can try to avoid his worries within that time. And within that time, I'll take your father to the operation theater. I'm assuring you, please try to understand my situation.
Okay. Can I have a word with the doctor who's on charge, who's on duty right now, or the head nurse is on duty? So can I communicate with them?
Yes, I'll inform you. Just wait. He'll come and talk to you.
Okay.
And your father is not, his vital signs are perfectly stable now. This is the right time to take him to the operation. So please wait for him. Please wait for the doctor. He'll come right now and explain to you about the surgery and all. If you have any further doubts, you can ask him. Do you have any other problems?
No, I just think that, I'm just wanting this weight thing to be done and get this over with. It's been overwhelming. It's been sapping all our emotions and energy into this. And he's been here and we want to take him home and have a successful surgery. So that's what I've been wanting to get that done, and that's
Let me assure your father will have a successful recovery from his surgery, and thank you for accepting words. Have a nice day.
Thank you.
Good afternoon.
Good afternoon.
I'm Anshu Daske. I'm one of the registered nurse working in this maternity hospital ward. How are you feeling today?
I can be doing better.
I came here to inform you that your baby is little bit yellowish today, so we are planning to take a blood test, and after that we'll decide for your child's discharge. Is that okay for you?
Well, nurse, I was really hoping that I could go home today. Is that any way possible or not? What do you suggest?
I can able to understand your situation. We'll try for it. First we'll take a blood test for your child and then we'll see what are the results, and after that we'll plan for that. And today your child is little bit sick and he is crying a lot. So, and also he has some signs of jaundice. His nails are yellow and also his urine is dark colored. So we think to take a blood test. Is that clear for you?
Yeah, but don't you feel that I should, I think I can probably give him better care if he's at home rather than at the hospital. I would really prefer that we go to the hospital. Get discharged today and go home today. That's what I'm looking at.
I can able to understand your concerns and feelings, but a hospital is better than a home anyways, because hospital there is so many staffs and doctors. They will provide continuous care for your child when he is sick and if he is not well. And your child's condition is not better now. He's not taking enough feeds and he's always sleepy and showing some signs of jaundice. So we'll check his blood.
So, nurse, if I may interrupt you, what causes jaundice? Why does he have jaundice and how?
That's a nice question. I'll explain it to you. In newborn babies, their liver is not well developed. So because of that, they'll produce a chemical known as bilirubin. It causes jaundice and it has it is very easy to find out because the child demonstrates some yellowish discoloration of the skin, as well as they have some signs like their urine will be dark colored and they will be sleepy and tired always. From this we can identify, and moreover we'll confirm it with a blood test known as bilirubin test. It helps to determine how much is your child's bilirubin. If it is more than 14, your child need to be kept in NICU, that is neonatal care unit. There we'll keep your child under phototherapy. It is a light. We'll directly keep your child under that light, and we'll close your child's eyes and genitals with some padded things, so it will be safe for your child. Is that clear for you?
So is this common among newborn babies, or what happens?
Yes, it's very common nowadays because your child's liver is not developed properly. That may be the cause of your child's this yellowish discoloration and other signs. And if your child's bilirubin is greater than the normal level, we'll kept him under the phototherapy, and after every day we'll check for his bilirubin level, and if it comes to normal, then we'll discharge your
So
child.
what causes jaundice? You were talking about bilirubin and other terms that I'm not very familiar with, but what do you think causes jaundice is the reason for this?
In newborn children, it is a common cause because their lungs may be not, liver may be not properly developed, and there may be chances of infection. It may cause this jaundice. So, if in your child's case, your child is not properly feeding, maybe because of that he may have landed up in this kind of things. Is that clear for you?
Yeah, he's been very sleepy, tired, and he's not been feeding very well too. So I'm really worried. Like, I wanted to get him out of the hospital. So usually kids, when they're in the hospital, the drab walls, nurses in uniforms, all this adds to the symptoms too. So that's why I was thinking that maybe being at home setting, he'll feel much more at home and be relaxed. So that will cheer him up. But
I can able to understand you, but your child is a small kid, so it may be a problem for him, and it is not serious condition. If we'll properly manage it for a time being, it can be controlled very soon, and we'll discharge your child very soon.
Okay, so the blood results come out. So what happens next? So what are we looking at?
If it is higher than normal, we'll transfer your child to neonatal care unit, and we'll keep your child under that phototherapy machine, and we'll again check your child's blood test after 24 hours, and if it comes to normal, we'll take off him from the phototherapy and we'll give to you. And meanwhile, every second hour you should come to the NICU and feed your child. Let me assure you, if you feed your child properly and if we get proper treatment, his condition can be managed very soon.
Okay.
Thank you for accepting my words. Have a nice day.
Thank you very much.